Hi everyone. During your child and adolescent class, we hope to present some of the most important information with regards to working with young people. Paying attention to the client and his or her environment and context will always be an important aspect of this work. With young children, issues of environment and context are especially critical to understanding the child's overall health and specific mental health issues. The facts. 1 in 4 children could be diagnosed with mental illness in any given year, and about 1 in 3 in their lifetime. The most common disorders are depression, anxiety, and attention deficit hyperactivity disorder. Less common developmental disorders and psychotic disorders in children may have a greater impact on the child and family. There seems to be no single cause of mental illness in any group. Children with psychotic illnesses can exhibit behaviors that are specific to their age and development, so the diagnosis of a mental illness must involve a combination of medical, developmental, and mental health assessments. A variety of treatments are available to manage mental illness in children, including specific forms of therapy, educational interventions, and medications. Children with mental health problems can have lower educational achievement, greater involvement with the juvenile justice system, and, if in the foster care system, fewer stable placements. In looking at the most common disorders in children, anxiety, depression, and ADHD, statistics show just how common these disorders are. ADHD affects about 8 to 10% of school-age children, depression about 2% during childhood, then rising to 4 to 7% during adolescence, and drifting upward to 20% by adulthood. Bipolar disorder and schizophrenia rarely appear in young children, but more so in older teens and those in their early 20s. Not as common, but very significant, are developmental disorders and autism spectrum disorders. The statistics on autism spectrum disorders occur in 1 out of 88 children. This is an increase of 78% in the last 10 years. Probably this doesn't mean that there's a new cause in that time, but that the spectrum has widened and include behaviors that were thought to be other things. As with mental illness in general, there is no definitive cause of childhood disorders. The children who are diagnosed with mental health issues tend to have biological, psychological, and environmental risks that factor into their development. Biologically, there's a significant association to abnormal levels of neurotransmitters like dopamine and serotonin, a decrease in size in some areas of the brain, and an increase in activity in other areas of the brain. Girls are more likely to be diagnosed with mood disorders like depression and anxiety, and boys with ADHD and autism spectrum disorders. These gender differences are likely a combination of biological differences and environmental differences, such as how girls are encouraged to interpret their environment in a more emotional manner compared to boys. Also, a child who has a parent with a mental illness is up to 4 times more likely to also have a mental illness. Teens who develop a mental illness are more likely to have other biological issues, such as low birth weight, trouble sleeping, or have a mother who was under 18 when they were born. Psychologically, risk factors for mental illness in children include low self-esteem, being overly critical or overly self-critical, and the feeling of helplessness when dealing with negative occurrences. Teen mental disorders may be connected to the stress of body changes, such as the fluctuating hormone levels of puberty and, possibly, ambivalence concerning increasing independence and the changes in relationships with parents. All of these factors, if severe enough, put teens at a higher risk of developing a mental illness. Environmentally, childhood mental illness can be a direct result of experienced trauma such as emotional, verbal, physical, or sexual abuse, death of a parent, sibling, or other loved one, or school problems such as bullying or peer pressure. Gay teens are at higher risk for developing mental illness, which can be exacerbated by bullying or the lack of acceptance by family. Children in military families are also found to be at a higher risk of depression. This could be connected to the nomadic lifestyle of the military, long absences of one or both parents, and the real worry of having a parent in a combat zone. Other environmental risk factors include a history of poverty, exposure to violence, gang involvement, social isolation, parental conflict, and divorce. There are many healthcare professionals who can help make a diagnosis of mental illness in a child, and such a diagnosis should not be made by any one individual. As in diagnosing mental illness in adults, all medical possibilities should be ruled out. The symptoms of childhood mental illness can be associated with medical conditions or can be a side effect of medications. Lab work should be done as well as other medical tests as warranted. The parents of the child should also be interviewed, and there are a number of good questionnaires and self-tests that can be used. There are two major approaches in treating childhood mental health disorders: interpersonal psychotherapy and cognitive behavior therapy. Most successful child therapists use a combination of theory as well as a variety of delivery techniques in working with children and adolescents. Few children willingly participate in therapy, and even fewer adolescents do so. Practitioners use such modalities as play therapy and art therapy to engage a child and develop a therapeutic relationship. Play therapy can mean playing with dolls, sand trays, and puppets, playing chess, card games, or even more physical activities like basketball with youth and teens. One modality that does not work well with children of any age is the traditional talk therapy, as would be used in treating adults. The major types of medication that are used to treat children with anxiety and depressive disorders are the selective serotonin reuptake inhibitors, such as Prozac and Zoloft. These drugs have a high level of effectiveness and have been approved for use with children. However, there can be an adverse reaction, including suicidal ideation. Parents and professionals need to remain aware of this. The medications available to treat ADHD are from both the stimulant and the non-stimulant class of drugs. There's no way to tell which works best in any child until they've been tried. However, these are fast-acting and have a short half-life, so short trials should lead to the right fit fairly quickly. Examples of drugs from the stimulant class include Ritalin, Concerta, and Adderall. From the non-stimulant class, Strattera, Tenex, and Catapres. Treatments for bipolar disorder are designed to address two things: relieving current symptoms such as mania and depression, and preventing the symptoms from reoccurring. Effective medications that have been approved for use in children 10 years and older are Risperdal, Abilify, and Seroquel. For the treatment of children diagnosed with autism spectrum disorder, Risperdal has been approved for children 5 years and older, and Abilify for those 6 years and older. As previously stated, children who are diagnosed with a mental illness are more likely to have lower educational attainment, as they miss more school and are at higher risk of dropping out. They are more likely to be involved with the criminal justice system and are less likely to have stable and long-term placements if they are in the foster care system. Those with anxiety and depressive disorders are more likely to get involved with drugs and alcohol, become young parents, and are at higher risk of carrying mental illness into adulthood. 85% of individuals that have one episode of depression have another within 15 years. Studies show that over 50% of adolescents with depression improve, but depression leading to suicide is still the third leading cause of death among teens. About half of children that are diagnosed with ADHD still have it into adulthood, and about half of those will have symptoms that remain problematic enough to affect jobs and relationships. Those with bipolar disorder can expect to experience some sort of mood problem up to 60% of the time. This disorder is generally well managed with medications and therapy, but there are severe complications if left untreated. The risk of suicide is 60% higher in those with bipolar disorder than in the general population. Prevention of childhood mental illness must address specific and nonspecific risk factors. The inverse of those risk factors include having supportive adults, strong family and peer relationships, healthy coping skills, and emotional regulation. Children of a mentally ill parent do better if they are able to focus on age-appropriate tasks such as school and play, and are educated about their parent's mental illness. This is easy to say, but to reverse and rebuild a child's environment is not an easy task and takes a great effort from many fronts to accomplish.